And we're live. I'm so excited. I think I say that every time I click live on these Wednesday nights, but tonight's really special for a few reasons. Number one, this is our fourth class, and I had some expectations for this series when I started planning it out, but I didn't know how emotionally invested I would get in just getting excited to click live and to connect with all of you through the past 4 weeks. So I just want to thank you for the questions, for the support, for all the guest speakers that took time to support this project, and to the parents that are investing in their knowledge and their own wellness and learning to be their own advocate. Thank you for being a part of my community, and I hope that I was helpful in some way in building yours. So with that, as usual, I am not a medical expert. And as always, I highly recommend all of these topics that we are talking about that you bring up with your medical practitioner or any of your support system, and continue to have dialogue. Continue to talk about your worries, your stresses, your fears, and figure out how to create that network of support so that while you go through every phase of your birth story, that you feel empowered and that you have a voice and that you are in charge of the decisions that are made for your family, and trusting in the practitioners that are supporting you along the way in building this story. So I'm going to jump right into our topic tonight, and that is the first part, what to pack for the hospital. And this is kind of a fun nesting project for mom, dad, partner to get ready for that labor and delivery. I really want you to take this as simple as possible. The last thing that we want to do is to just put on bags after bags after bags and load up a car of lots of things that you'll never use in a time when you're most vulnerable and maybe having some anxiety and maybe feeling a little stressed or worried. We want to alleviate all of these things that are not necessary to worry about. So I'm going to break it down for some real simple stuff, and then there's some other things that are pampering and comforting for you to create that really warm nest-like feeling within the hospital environment. So go on ahead. I broke it down in two different bags, labor and delivery. This is going to be that bag that you need when you go to the hospital for the first time. The next bag that we talk about after this is really the postpartum bag, and it's something of more comfort, supplies for your baby, but this first bag, let's go through. So what I have right here are some essentials for mom, and that's any kind of paperwork. I highly recommend working with your hospital on the front end to get all of your paperwork done before labor and delivery. Before you get to that hospital on that day, hopefully it's all within their system, and have a conversation with them. What does that look like? What do you need from me? What do I need to sign? Because when you're going through a surge or a contraction, you really don't want to be holding a pen trying to sign your name perfectly. You want to be in the moment. You want to take on that wave, let it come, and be right there and let it go, and not worry about anything in between other than taking care of yourself and resting and getting ready for that next one. Something that is really comfortable for moms, bring warm socks. Bring your own favorite socks, because you don't want to wear the hospital socks. Just trust me on that. Slip-on slippers with grip. You're going to be walking the halls as we talked. We want to keep you mobile, moving, even in your own hospital room. It's a hospital. It has its own kind of bacteria in that environment. So we want to keep your feet clean and keep you comfortable while walking around as well with that cushion underneath. So slip-on slippers, shower flip-flops, get in that water, shower, whatever that looks like for you, sitting in the bathroom, maybe with that shower head going all over you. But keep your feet clean. That's a great thing too. It's not a necessity, but I do have moms that prefer to have their flip-flops with them. Cardigan or jacket. Temperature in the hospital kind of just fluctuates. Your temperature fluctuates. So you want to have the ability to maybe have a sweatshirt, something maybe with a zipper, nothing that goes over your head, something that can be accessed so that if you have wires or if you just want to put it over your shoulders as you walk the halls, it's easy access for you to find some extra warmth really quickly. Toothbrush, toothpaste, keeping that mouth fresh. Sometimes when you're going through the different phases of early labor to active labor to push time, you want to kind of change up that energy. So brushing your teeth is a great thing. Face cleansing wipes. I highly recommend, don't get the scented kind, because that day you may not like that scent. But an unscented facial wipe, if you're in bed, say maybe you did have an epidural that's keeping you in bed, you're not able to get to the sink. So it's something that's easier to just use right there for application. Elastic rubber bands and bobby pins are the biggest thing requested when I'm on my way to a hospital to help a couple. So pack some in your purse or in your bag so that that's right there. You can throw that top knot on top and you're ready to go. Deodorant, chapstick. Chapstick's big because you're going to be doing a lot of breathing. It dries out the lips. Have a great one that you like. Sometimes they're flavored. I don't know how sensitive you are with scents, but just keep that in mind as well. Lotion or coconut oil. Lotion is great, or the coconut oil if you prefer something very natural and food grade is what is preferred. It is great to hand over to your partner to ask for a foot massage, shoulder massage, and just add to that connection. And the two of you being together in that labor and delivery room is a great thing for that really comforting piece to your labor and delivery. We have pillow. Okay, they have a lot of pillows in the hospital. They're not great. They're great for putting you in positions and supporting you to, hold up your chest over a ball or against the back of your bed. Some of those positions that we showed in the last class. But they're not cuddly and comfy and warm and cozy and reminds you of home. Bring your favorite pillow and bring your favorite pillowcase. It will make a difference. It's great. Essential oils. Now, if you hire a doula will come with a doula bag, and she will have all kinds of tricks inside that bag, and typically some of those essential oils that you guys have talked about on the front end that just soothes you or enlightens and gets you ready to get into the next phase of whatever you're trying to do. But if you didn't, you can still do the same thing for yourself. So finding out if you like lavender or maybe something citrus, and just having two. Don't have a ton, and like we went over, just put it on that paper towel, put it on your pillow. If you don't like it, crunch it, throw it away. It's never to be smelled again. We have on this list, I feel like this is really important, a speaker, or as a doula, I traveled with a small little laptop that I was able to plug in and have some hypno meditation tapes going, Spotify all tuned in for favorite lists if it's upbeat or if it's something very natural and grounding that's accessible in your room. Make sure you have your charger for it. But setting the tone of that music, or if you need to change the energy within the room, you can plug into that and quickly change everybody's energy in the room. If you want everybody to mellow down and be quiet, you can turn those lights down, turn on that meditation tape. If you want to get enlightened and ready to get all that energy going, put on your favorite pop songs or raps or old school music. I have had a lot of fun dancing with couples in their hospital rooms, and it's a little party that nurses have enjoyed as well. So bring that speaker, phone, and charger. Make sure that you have your chargers with you. I know that you'll probably have some family and friends that are checking in and wanting to see how you are progressing. It is up to you on when you want to have a conversation with them and how plugged in you want to be with that. But have that there just in case you need to say, hey, Dad's really hungry, Mom's really hungry, can you bring us this? Can you come and support Mom while partner takes a nap? Those kinds of things are needed. So if you have your phone, it's a great thing. Water bottle with a straw. Staying hydrated, moms, really key. We need you hydrated, and you're going to be in all these different poses. So one with a straw really helps with access to getting that water quickly and efficiently. The next thing I have is earbuds. If you, which I'm wearing right here, if you have those with you, you can plug it into your phone and have your own music. If you want to just channel something of your own taste at that moment, you can do that and kind of let other people know that you're trying to escape from the scenery around you. It's a nice way to just plug your ears, and I've also put a night mask on there. So if you have a night mask, just put that on and lay in your bed or in the position that you're being supported in, and everybody will know that you're trying to just ground and center yourself. Rice heating pad. You can take a regular heating pad, but sometimes in the room it's a little bit hard to find the plug. Some beds have plugs, some don't, some are near them on the walls and you need an extension cord. So what I like is, and I found it at CVS or Rite Aid, Target, they sometimes have them, and it's a rice heating pad. All it is rice inside a cotton container that can be microwaved, and it will stay warm. If you microwave it for about 1.5 minutes, 2 minutes, it will stay warm for maybe 20-30 minutes. That helps with mom. If she's getting chilled, we can put that on whatever part of her body that's going to warm her up. It's just something that's very cozy. Glasses and contacts. If you need them to see, make sure you pack them. Next. Okay, so this is something that you won't see on your Pinterest pages, but dads need to, and partners need to pack some stuff too so that they're comfortable and able to support in the best way possible. So what I highly recommend is that dads or partners wear a button-down shirt. And the reason why is because if mom is not in a state to be able to hold baby to her skin, which we're hoping for, but if she needs support and needs your skin to warm your baby and to connect, that it's easy for you to unbutton in front of lots of people and then place the baby here. If you have a t-shirt on, you will be removing your t-shirt and walking around a room with what are kind of strangers at that point. And I've just seen some partners get a little uncomfortable with it. So the button down really helps out. Sweatshirt or jacket, because mom might be really hot and we might need to freeze out that room. You're going to be cold. So make sure that you have something that's going to keep you warm at those times. Shower flip-flops, as I said, exactly the same reason for mom. Swim trunks or swimsuit, so that you can be comfortable in the water and then also keep your clothes dry and be supportive in that cold air-conditioned room on the other side as well. Deodorant, toothbrush, toothpaste, keep it fresh so that you feel like you are awake and you're ready to help. If you take that nap and you just need to revitalize everything that's going on, those are great things that you can do for yourself. Gum. If you go and grab lunch, breakfast, dinner, whatever that is in the cafeteria, or your mother-in-law or mother brought you something delicious to eat that mom just could not stomach, and then that's on your breath and you're trying to get very emotional and deep with her, she doesn't want to smell it. So keep some gum on you, keep it fresh. Cash or credit card, keep inside your bag, just have some dollar bills, whatever that is. But the cafeteria closes at certain times, and I've had dads that just want to get a snack, and there's always vending machines inside of hospitals. So keep some cash on you. Sometimes the credit card machine doesn't work, sometimes the cash thing doesn't work. So if you have both, you're most likely going to get some Cheez-Its or whatever you're looking for out of that vending machine then. And your ID, just so that the hospital will let you in, and that you can be with mom. Typically, you don't have to, I don't know. I've seen it both ways where they've checked dad's IDs, and then other times where you're already in the system and there's a picture. So just make sure that you have your ID with you. Food. Keep it simple. She's going to keep it simple, so you guys keep it simple. Keep away from acidic items or anything with strong coloring, like Gatorade with red dye or blue dye in it. Not a great thing, especially if she gets nauseous and she needs to vomit. It's just harder on the system. So if you keep things simple and mellow, like smoothies, and when I talk about smoothies, maybe something like strawberries and bananas. Sometimes greens really help, like those green smoothies that you can get, or juices are easy for mom to get some calories, some sugars into her system to help her run this marathon of birth. a banana I put on there. Coconut water is one of my favorite things to bring to a hospital. The hospital will ask mom, hey, do you want some juice? And then they'll bring these juices, and they are very sweet. They're like crazier than any other sweet drink that I've ever had. I don't know why, but they just are in the hospital, and moms are really sensitive to taste at that time. So I like something mellow. If it's water, coconut water. They work really great for hydration. Coconut water also gives her some of those sugars, and just it helps with keeping her energy going. The postpartum bag. Okay, so this is a little bit more comfort going on. We have a robe, a nightgown, something that's loose fitting on you, that's going to flow, that's not going to pinch in an area that maybe is sensitive on your body in that postpartum phase. A going home outfit, nursing bra, breast pads, nipple cream, shoes, dry shampoo. If you want to wash your hair and take a shower, you can do that. I have other moms that don't even want to touch their hair, but they want to take a nice picture, so they put dry shampoo. That's luxury talking right there. You don't need to have that. It's just an option to maybe bring a brush and a styling iron. You can just spray that in and do your top knot again. And then makeup, moms, like, you know, you want to look nice when you're leaving, so some opt to bring their makeup for those pictures when you're arriving home. And getting in the car, and it's just exciting. It was a great time. Baby, most important, make sure that you have a car seat and the base of the car seat all prepared and in the car. I highly recommend to also go and maybe like a Babies R Us. They will have a lecture on how to appropriately put the car seat in the car and how to strap your baby in. Things are always evolving and changing, and they will have a professional come and make sure that it's secure in your car so that you don't have that extra anxiety. Did I do it right? Or trying to do it for the first time when you're going home. Do that on the front end before labor and delivery starts. A nice swaddle. You will have lots of swaddles inside the hospital. I've just had it where grandmas or mom or dad want to have something that's softer or appropriate for the photos that they're looking for. So if you want to bring swaddle, bring a swaddle. A hat, keep that head warm, so you can just have that little peanut all wrapped up and adorable. Going home outfit or a picture outfit or both, that's up to you. Just minimize what you're bringing because you don't want to have a lot of bags. And then something that moms like too are the footed one-piece sleepers. So those are just kind of some things that you would find. If you want to take a look and maybe elaborate on all of this, Pinterest has lots of ideas for you. But I highly recommend add in that stuff for dad or partner for that labor and delivery bag. This is why I'm so excited for tonight. I think I went through this on our first class, but the reason why I really found myself getting passionate about the birth world and especially about the birth education was from my previous experience within the mental health world. And for years, I used to read applications of young adults and adolescents coming into treatment. And I would always read the birth story from mom's perspective. And I would see repetitively through every application that there was not a highlight of good through that birth story, that there wasn't empowerment, that there was loss of voice, that there was a lack of ability of ownership and strength, and that mom never got that back, or child went through so much and parents didn't know how to step in because they always kind of reverted back to that anxiety or fear that they felt through that experience in their baby coming into the world. That is not scientific. This is me just making my own kind of judgment from reading what I was reading, but it engaged me enough to realize that even though it's not scientifically proven, that women need to figure out how they can be their best advocate, that their partners can also be their best advocate. And when they work together, great things can happen. struggles of your past can evolve to greatness when you understand your own strengths in the most vulnerable moment of your life. And that's what birth can do for someone. It can also get you ready for the future and figure out, if I've had struggles in the past and I'm going to go through this vulnerable moment here, that I need to prepare on the back end like this, with this support system, in order to know that I feel like I can be heard, and that I can ask for help, and that I will find good in the future as well. So that's my connection to all of this, and I'm going to go forward with a little bit more. So I want to define a few words for you. We've got prenatal, perinatal, and postpartum. These are all words that we've been using throughout the series. And just as a reminder that these are all times for moments in time. So prenatal, before the birth. Perinatal, the weeks really close before and after the birth. And also postpartum, that phase, anything in that time frame of after the baby has come into this world is the postpartum time. So as a parent expecting, you will go through all of these stages. How you step through those stages will be defined by your own story of what your history is, of how you are faced with anything that comes to you in that moment, and how you decide to go forward. And if you're having trouble going forward, there are solutions and there are people that can help you do that. Before we dance into our guest speaker, though, I have been struggling with this one topic, and I've asked lots and lots of moms and dads and partners, what's the one class, if you could have taken a class before having birth, that you would have taken because you didn't? And it's always breastfeeding. And I feel like it's always that first struggle for mom to define how she's going to do it, what her strength is in it, what when you have professionals in your face telling you your baby needs to eat more, you're not producing enough, you need to formula feed. How are you going to step into that and feel comfortable knowing your body and how it's reacting to what currently happened to you, and how your body presented the day of birth and how it's healing going forward? So I don't want to give you actually a breastfeeding lecture. I want you to reach out to your community now and figure out where your local breastfeeding network is going to be. So if that's a lactation consultant or a breastfeeding networking group that you can go and sit with other moms and hear their story and connect and get some answers, that's what I want you to do. What I have done for you is under the Ask a Question, I've put things in there like the La Leche League, and you can put in your state and your city, and we'll show you all the breastfeeding groups in that area. I've also put in Robin Kaplan in San Diego. I've taken one of her courses, and I think she's phenomenal. So if you want to kind of get her perspective on breastfeeding, she's got some materials up on her website for the San Diego Breastfeeding Center. And I've also put on a great YouTube video that shows you how to support your baby latching. So you'll hear a lot of the time, babies know how to latch. It's mom that has to develop that connection with baby and figure out how to position and to get in the right position. I think it's both ways, actually. I think both of them have to figure out, what has this world given them structurally with the breast, with the baby's mouth? What's going on? How are we going to connect? How are we going to make that great latch so that mom's safe and protected from wounds, and that baby is getting the nourishment that baby needs? I've also added on there the benefits of breastfeeding. I don't want to go into the benefits of breastfeeding other than saying there are lots of benefits for health and wellness when breastfeeding. What I also understand is that breastfeeding does not work for everyone. And if that does not work for you, you are not failing. You have not done anything wrong. This is either something that has happened to you in your life that you're not able to breastfeed, and so you have to choose a different route. And this is your opportunity to do some research and figure out how you're going to best support your baby and yourself mentally with that connection, and how you're going to feed and support and nourish your baby. So I put all kinds of stuff under that Ask a Question area, and I really hope you check it out, look through it, and get the support that you need. If you need help connecting with anybody in your area, as always, you can email me, and I'll do my best to get you connected. The best thing that you can do when going through this welcome home phase is to hold and smell and care for your baby. People will be calling and texting, can we come see you? What can we do? How can we help? You actually don't need them to do anything for the baby. That's you. I want you to connect with your baby. You and your partner connecting, changing diapers, swaddling. I'm actually going to go through this right here. So diaper changing for dads and partners, if you can take that on, it's a great thing for you to take the time and be with your kid and to alleviate that piece for moms so that she can focus on healing. Now, some moms really want to be a part of that. So if you want to be with your baby changing diapers, do that. Speak up. Say, yes, this is something I want to do. But if you're a partner looking for ways that you can do something that mom doesn't need to do, that's a great one. Swaddling is another thing. I have a great friend who became a master swaddler, and he swaddles better than any mom that I know. And it was very helpful for both of his babies. Empower mom's voice. Always have a discussion. Don't just do things because you think it's best. Sit down with mom and talk with her. If she's on pain medication coming out of the hospital, if she's tired, if she's just struggling emotionally, she still has a voice. And so you have to make decisions together, and that she's not getting run over or feeling like decisions are being made without her. You guys have to unite and be together on the same page. And that's going to be the same way as you go through the development of your child. I'm aware that you're not always going to be on the same page. I'm not saying that, but there has to be a discussion to figure out how you're going to support your baby as a couple. Ask for help. Dads, partners, you don't have to do it alone. So ask for help when you can't do it, when you don't have the answers, or if you need a nap, or if you need a moment for yourself, you deserve that as well. So ask for help anytime and figure out who's going to be most supportive in your network. Act with compassion. Kind of goes back to empowering mom's voice to understand what she's just gone through for all those 40 plus weeks, and understand that labor and delivery, you were right there. She is going to need a year to recover. And so give her that time and give her that empathy and compassion. Something that's really helpful for breastfeeding, if you're looking to help out and connect with that, create warm compresses. Just washcloths in warm water, give them to mom before she breastfeeds. She can put them on her breasts, and it will help the ducts know that it's time to supplement milk and feed baby. You can also help with the side breast massage, but you're not allowed to do that unless mom says that you can, and you have to be very gentle. But helping relieve those ducts of the milk and to come to the tip of the breast is very helpful for keeping the ducts flowing and not getting any kind of clog in them. Protect the space and time. I think for a couple weeks, I really like it when couples just shut down and go home and just nest and figure out the rhythm of their baby, that they figure out and have little arguments. That's good. You got to figure it out, right? Have the conversation of, I would like to do that, I would not like to do that, and feel like you can be honest with each other, and that you're not dancing around other people in your environment, that you too have the space to figure out this whole new world together. The time as well, if you're going to have visitors, they must have a role. They need to either bring food or do a chore, and trying to keep them there for maybe like 20 minutes, 30 minutes, and then it's goodbye, so that you guys can get back into your pattern and rhythm, is really helpful for those early stages of connecting with your baby. So maybe having a key word like, hey, hun, did you take out the trash? And then it's like, okay, that's time for dad or partner to say, thank you everyone for coming, but it's time to go. Validate mom. Tell her she's doing a great job. Mom, it goes the same way. You're going to ask a lot of dad and partner. So make sure that you validate him or her as well. Tell them, you did a great job with this swaddle. Thank you so much for keeping us on time, or I really appreciated when you did this for me. Validation from both sides is a great thing because it's so stressful that if we can create some positive communication, that's going to help both of you grow. Bring baby to mom. So she is not supposed to be lifting. She's got no abs and she can't be thrown at her back because she needs to get going with this whole new world of being a mom. So when it's time for baby to feed, when it's time for baby to have a diaper change or whatever that looks like, bring baby to her. And that will alleviate a lot of like bending over and picking up. Take care of yourself. Mom can't take care of you right now, so you really got to step into the role of protector of her, baby, and yourself. So if that's taking a few minutes to be mindful, that's going for a walk, taking a nap, eating healthy, maybe doing some physical fitness, whatever that looks like, make yourself a priority as well. We kind of went through how can friends and family help, and I want to go quickly through it, but schedule meal drops, laundry, dishes, errands, hold the base so a parent can take a shower. That's really the only time other than, or if mom just can't hold baby anymore, or a partner needs a break, of course, having that friend or family member hold baby, but having that smell and connection with baby is really important. So if we can keep baby with mom on her chest, regulating temperature, or just regulating time to understand sleep and breastfeeding is a really great place for where baby should be. Short visits, as I said, and give time for connection and rhythm to start building up. All right. Whew, I'm a little 2 minutes behind, but I think we're going to do great. So this next part is when I'm going to invite our guest speakers. So I'm going to invite Rachel Rabinour, LCSW, and phenomenal San Diego therapist on the screen. I've invited her. We have tested this before, so it should go very smoothly. Her entire bio is in the right column or below you, and she's connecting. Yes, that was our smoothest connection yet. So I am so grateful that you made time to come on for this webinar tonight, and I think you're phenomenal. We've engaged just a couple times in person, but sitting in the office that she's sitting in right now is a really special space, and she's a very easy person to talk to. And if you take a look at that bio, she is phenomenal in creating community and connecting couples to this journey of birth. If there's the struggle on the front end to any struggles transitioning through postpartum, she is capable of working some magic right there. But the thing that I really liked is this statement that you have on your Instagram that says, Rachel Rabinour, supporting women and families with transitions to and through parenthood. So you see it all. And my first question for you is, what is your drive for the work that you do?
Well, first, I need to thank you for the really warm welcome and the beautiful introduction there. I've really enjoyed engaging with you in social media and also, of course, in our time together face-to-face. And I can't really sing your praises enough. So I'm so glad you're doing this wonderful webinar. This is such a gift to offer to the community. So thank you for inviting me to be part of it.
Thanks for joining.
So what is my drive? How did I get here? Well, through Latin America. That's how it originated. I was traveling in Latin America and met a young woman. She was about 18 years old, and she had a 3-year-old who was disabled, and he was carried everywhere. He couldn't feed himself or walk. And I learned that she had, this was in Guatemala, and I learned that she had tried to induce an abortion because she didn't want the baby. So I came back to the United States and I enrolled in graduate school. And that really just stuck with me, just the inequity of healthcare for women around the world. And of course, the mental health of women going through this perinatal period. And that really, came back to the United States. I started graduate school. I knew I wanted to do some work around this period of time. I just knew it was so precious and so fragile for all women. And I wanted to work in Latin America. And then suddenly I realized, well, there's a lot of work to do here in the United States. And so I was living in New York City. I got a job working at a pregnancy prevention program in New York City. And I did that for a couple of years. I came to San Diego and did another great program. It was a prevention program for various things, taking at-risk youth into the outdoors. And I loved that work, but I missed doing a lot of the one-on-one. I was leading a lot of great trips and exposing kids and doing a lot of great prevention work. But I wanted to reconnect with the pregnancy issue. And so I started working for SANDAP, which is the San Diego Adolescent Pregnancy and Parenting Program. And I became a therapist. It's through San Diego Unified. And so I worked with pregnant and parenting teens for 5 years. And it was during that time that I had my first child. And just my experience working with pregnant and parenting teens, I was exposed to a lot of what it is to become a parent. Mm-hmm. Obviously a very hard transition if you're a teenager, but then I became a parent myself, and I realized that, oh my gosh, how hard must it be to be a teenager? I'm already experiencing this. And I didn't have a diagnosable mood disorder or any depression or anxiety. I didn't have a birth trauma, and it's hard. And so my empathy just grew even more. And it was also while I was working at SANDAP that I experienced my own secondary infertility. So I struggled with 3 miscarriages after the birth of my son before finally conceiving my daughter. And so that really expanded my ideas about what I would do. I knew I always wanted to have a private practice at some point, and it really quickly solidified that it would be around the pregnancy and postpartum period. And then it expanded because of my own personal experience. And so while working at SANDAP, we didn't have a lot of extensive training around perinatal mood or anxiety disorders. And so I sought that out for myself so that I could better serve my clients there, and then land myself where I am right now, that I'm doing this as my my work now. So that's how I got here.
It's incredible work. And I wrote, I think I shared this with you, and I wrote my post about what we were going to cover for this class. And then you just blew it out of the water with the focus that you had for the current work that you are doing. And so I want to kind of elaborate on that and look at perinatal mental health and what are some of the risk factors and warning signs and symptoms that we can kind of pay attention to if we have a loved one going through this experience, and really digging into figuring out what this whole PMADS issue is, and how you can kind of break that down for us. So I'm going to let you elaborate from there.
Okay, sure. So if people out listening are pregnant, I think we can maybe start there. Some things that you might want to pay attention to just in your own history. Now, there are risk factors, but they are not it's not causation, right? Because you have some of these risk factors does not at all mean that you will develop a perinatal mood or anxiety disorder. But it means you're at higher risk. And there are also women out there who have no risk factors, and they do still find themselves struggling with a PMAD. So maybe before I even launch into the risk factors, please. I want to just clarify what is a PMAD. Yes. So a PMAD, perinatal mood or anxiety disorder. And so under that umbrella, people are really used to hearing postpartum depression or PPD. And we want to be really clear that there's more to a PMAD than depression. In fact, the most common symptom that women struggle with after the birth of a baby or when they're struggling is anxiety. So 1 in 5 women in the perinatal period. And so we talk a lot also about pregnancy. people are surprised to learn that you can get postpartum depression, postpartum anxiety while pregnant. So those two are both covered under this umbrella of perinatal mood or anxiety disorders. Birth trauma is another one. Postpartum OCD, it really falls underneath the anxiety. So anxiety would be, phobias, and OCD. Those would be intrusive thoughts and intrusive thoughts, and I'm blanking for a minute, but it'll come back to me. And psychosis, that's kind of the last arm there. And while really, really rare, people often kind of confuse postpartum psychosis with postpartum depression. They think, oh my gosh, I'm so afraid I'm gonna kill my baby. Well, the reality is that only 2%, 1 to 2 in 1,000 women will experience postpartum psychosis. And then there is a risk for infanticide with postpartum psychosis and postpartum depression, but the fear is that people are going to harm their babies. And really that is a very, very small chance, but we do want you to get treated. And postpartum psychosis is an emergency, right? It is a psychiatric emergency that somebody needs to go immediately to the hospital. So I just want to put that out there. There's a lot of distinction between each of those illnesses. And so let's start there.
That's beautifully stated. Thank you.
Thanks. Okay, so now risk factors. So having a personal history of a mental health issue or mental health illness, either yourself or your family, that's one risk factor. Having any difficulties around your birth and your pregnancy. So if you did struggle with infertility, with loss, miscarriage, if you had a traumatic birth, that's a risk factor for developing a perinatal mood or anxiety disorder. If you have a high needs baby, a colicky baby, any kind of illnesses with your child, that puts you at higher risk. Having a history of childhood abuse, whether it's in interpersonal violence or from a parent or adult, any kind of childhood abuse. Stress can put you at risk. Not having a social support network, not having your family nearby. We have a lot of military, we have a lot of transplants here in San Diego, and I see a lot of women come into my office who don't have a lot of support nearby. Let's see if I missed anything. So yeah, those are really the main things that are risk factors. There is a personality traits. Well, it's not technically a clinical risk factor. Karen Kleiman, who's one of the grandmothers of this field, she points out that having kind of like the type A perfectionistic personality, it's a factor to consider. So it's not necessarily it's not declared a risk factor, but it's something to take notice of if that trait is within you.
Yeah, having some mindfulness. That sounds really good. Now, with all of the warning signs that, not saying this is going to happen to you, but just, just recording what has happened in your life or what is currently happening around you and being mindful about how you're going to go forward. What are some ways to prepare for positive mental health support through that perinatal postpartum phase when parents are either in the hospital or returning home and figuring out in those first months of life with baby at home, how can they best support that transition on the front end?
Right. Well, so if you are struggling, if you're pregnant and you're thinking to yourself right now, if you're listening and you're thinking, okay, this sounds like me. I've had a history of X, Y, or Z. What should I do? How can I prevent this from happening to me? We really want you to increase your support for the postpartum period. Hiring a doula, right? That is, I think research shows something like stress. Yes, exactly. Stress and fatigue are two of the leading causes of postpartum depression, right? So having a doula for birth, but also for the postpartum period, right? Having somebody around to be supportive, to help you learn the ropes. You know, we think that we're just going to fall into this motherhood role, and it's not always so easy, or the fatherhood role. It's not just motherhood, but the parenthood role. It is an enormous transition that really, I could tell you it's enormous, and you probably have heard it and read it, but it's big. And so hiring a doula, having somebody around to help ease that transition, that would be wonderful if you can do that. Another great thing to think about is really making a schedule for your family. You talked a lot about this before I came on, but
please elaborate.
I'm sorry.
Please elaborate. Tell us more.
Yes. Yeah. No, you talked about, the mother's physical recovery. So how is that going to look? How does that actually happen? If partner or dad goes back to work on day 5, well, how is mom being cared for? Right? Sometimes that's a necessity. Sometimes, the partner is not available to be, as supportive, hands-on. They may be supportive in other ways, paying the bills and keeping things flowing, but mom is just had a baby, and so she needs support, physical support as well, to do the cooking, to do the cleaning. Who's doing these things? These things add up. Taking time to make an inventory of this change of your roles. So even that's the immediate period, right, that you really spoke very well to, about, making sure mom and baby and dad and baby are bonding. But what happens 2 months down the road, 3 months down the road? I see so many women in my practice who come in at 4 months, 6 months, 8 months, 1 year postpartum, and they think, I should have been over this by now. I thought I was, out of this. It can't be postpartum anything. That's, there must be something else wrong. But really, if you don't have the support, if you're not nurturing yourselves in the early postpartum period, it does catch up with you, and it does continue. It doesn't really go away. Well, I shouldn't say that. Sometimes it does go away, but a lot of the time it can stick around. And sometimes it can just develop over time because there haven't been good systems put in place, and people are overwhelmed over time, because it is an overwhelming time. But having some structure, right? Having clear expectations about who's going to do the cleaning in the house. How often are we going to do the cleaning, right? Really sitting down with whoever you're living with and figuring this out, because that can really stress people out. Like, some people hate a dirty house. And so they're up and they're cleaning, even though they should be resting and sleeping. The cooking, right? Meal planning, that's another great one. So if you're pregnant right now and somebody offers to have a meal train for you, please say yes. Let's see what else. Sleeping and resting, right? Those are other big ones. And some people find it really hard to sleep. Everyone hears that phrase, sleep when the baby sleeps. But that's not always feasible for lots of reasons. But I do encourage moms to rest, to sit down and put their feet up, even if you're holding your baby, but resting and not cleaning when the baby's sleeping. So planning for family visitors, that was something you talked about, and I guess that really does continue even if 2 months, 3 months, 5 people come and they want to make their baby, and having a plan for how that's going to look. And like you said, I love that. Don't we have to take the trash out? Little cue word. That's perfect. But really thinking about how all that's going to look and who's going to be helping you out over time, or helping you out over time. Sometimes it can be a lot to have visitors.
If it starts to get to a level of I'm sorry, I think I'm getting a little feedback, but okay.
I don't hear what you're going to
So if emotions start building to a level that can't be managed at home anymore, what are some kind of techniques or modalities that dad or partner can kind of look for mom, okay. Or the other way, if and we'll do some clarification around that too. Who gets affected by mental health issues? Is it just mom? Is it just only her story, or is it a full family effect, couple effect? But what are some resources that can really be sought out in order to have solution and success?
Great questions. And I really want to touch on that. Yes, I've referred to mom as the identified client here, but there are 1 in 10 dads does get perinatal motor anxiety disorder, in contrast to 1 in 7 women or moms who get a PMAD. The rate doubles, though, I'll tell you. So when mom is struggling, the rate for dad doubles. So from 1 in 10 to 1 in 5, right? So that's pretty significant. So there's a very high likelihood that if one partner is struggling, the other one is too. And resources. So some local resources is the Postpartum Health Alliance. So we have a website, we have a warm line. I'm actually a volunteer board member with them. Thank you. Yes, I'm in charge of their training, but so reaching out to the Postpartum Health Alliance would be one. So through their website, and they also, like I said, have a warm line. So it's not a hotline, but you can email in your concerns, or you can call and speak with somebody. They'll return your call within 24 hours, and they'll connect you with whether it's a support group or individual therapists that are within your insurance or whatever your criteria is. They'll do their best to help you connect. Postpartum Support International. So if you're not here in San Diego, Postpartum Support International, they have volunteers in many, many, many cities throughout the world, actually, and they can direct you to local resources in your area. Of course, if you are concerned about harming yourself or your child, there's a suicide hotline, and of course 911 if you are feeling that you or your child is at risk in this at a particular point. Did that answer those questions?
That does. That really helps. Can you elaborate on what you specifically do as a therapist in your office, what you've seen as a technique or modality that's really helped?
Sure. Well, you know, one of the things that what I really do straight away with my clients is I look at their support system. I look at how they're eating, how they're sleeping, exposure to sunlight, exercise, you know, depending how far along they are, how far postpartum they are, and how appropriate the exercise piece specifically is. But I really try to shore up those aspects first to make sure that she's in a place to be able to do any additional work. And oftentimes, those things alone will make a really huge impact once they realize, oh wait, I'm not eating, I hardly eat lunch. So I also bring in their partner. That's one of the things that I do right away as well. Have their partner come in and hear a little bit about what their experience is, and also to help encourage and support mom, and to also encourage and support dad. So a lot of times dad will need his own support. And so that really gives me a better picture about what's happening for the couple and for the family, because I don't like to assume that dad should be, or partner should be helping mom. Sometimes it's a larger systemic issue. And then we'll start to, depending on what the concern is. So as you mentioned, I'm trained in EMDR, eye movement desensitization reprocessing is the long name. But that's an evidence-based treatment for trauma. So I see a lot of clients who have struggled with traumatic birth. It's also very helpful for anxiety when people have been struggling long-term with anxiety and depression. It's also a useful strategy. So I do use that with clients. And so, I mean, I don't want to spend, we don't have that much time to go into the details of it, but we
might have to do a different broadcast for EMDR.
That would be a whole thing. I don't want to go too deep. Cognitive behavioral therapy is another kind of therapy that is evidence-based for women and men who are struggling with depression and anxiety, and also postpartum issues, depression, anxiety. And I am in the process of being trained, or I'm about to be trained in interpersonal psychotherapy, which is another evidence-based treatment, which is a time-limited, I believe it's 16 to 20 weeks. 12 to 16 weeks of treatment. And it really looks at the interpersonal relationships in somebody's life. And so that really resonates with me, because that's kind of at the core of my own graduate school training, and something I just have always gone back to, is looking at the relationships and how they are impacting what's currently showing up. So
I really appreciate just listening to you, and I've talked with a lot of therapists through the years, just professionally, and your your effort to be on the cutting edge, to continue to learn, to bring like the best technique to your strength and whoever's sitting in that chair across from you is really, really incredible. So thank you for doing that.
Thank you.
If somebody is looking for therapeutic support for I'm going to back that up. If somebody sees that their loved one is in need of some mental health support, what is the best way of bringing up that topic to them without lighting a fire, but coming from love and hoping that they'll actually take the hand being held out?
You know, what my experience has been that partners and close family, parents, the grandparents of the baby, are often the ones who really identify that something's not right, because often the mom or the dad or the partner is what they're experiencing. They think it's normal. They think this must just be what it's like. But from the outside, people are able to see that they're really not themselves at all. And when they hear that reflected back to them, when somebody's able to say, you know, I'm really concerned about you, Christina. I notice that you're crying a lot. I notice that you don't really do the things you used to like to do. I notice that you're really irritable or angry all the time. I'm just kind of listing a host of different symptoms that might be showing up for somebody. And I'm worried. Do you think there could be something more going on? Or better said is, I think there could be something more happening. You know, I think that maybe you might be struggling with, you know, postpartum depression or postpartum anxiety, or, you know, you had a really difficult birth and that was really traumatic. And I wonder if really some of these symptoms that you're showing are related to that. That was hard. You've been dealing with a lot. I think we should go see somebody. I'll go with you. You know, so really just speaking from the heart is my best recommendation, is to really share with, you know, your loved one that you're worried about them. And most of the time it is met with acceptance and feeling seen.
Mm-hmm.
You know, that they sometimes people think they're like pulling the wool over everybody's eyes, that they're just gonna keep on going. They put their makeup on, they look perfect, they go off to, you know, we're out of the house, but really they're hurting so hard inside that they're trying to prevent the other people from seeing it, because sadly it's still seen as very shameful to have these difficult emotions after the birth of a baby, which is supposed to be the happiest time of your life. Yeah. And that's why it's so underdiagnosed. You know, we know that 1 in 7 women struggle with a PMAD, but yet only 15% receive professional help. It's a really small number when so many are really struggling. 15% of those women are getting professional help.
Looking at that number, if a PMAD issue is ignored or not treated, what could possibly kind of come up in the future that might be of danger, or that hurdle of never getting to a level of happiness and always feeling like something is missing?
Well, you hit it there. There may be, you may wind up struggling with recurrent depression. That's one risk. The other risk, which really we have to highlight, is that there's a baby involved now. So it's not just about you, right? But your relationship with your baby may struggle, right? Your bonding and attachment with that baby. It's very difficult to stay attuned to your baby's needs when you're not really present for yourself, right? How can you be present for anybody else? Long-term impacts of having a depressed parent correlate with developmental delays, cognitive developmental delays. And then even later in life, you might find, you know, aggressive behavior in toddlers and young, early childhood years, and even drug or substance abuse later on. So it doesn't necessarily go away on its own, and it's really important to get the help you need. You deserve the help you need. If you're listening and you think that you might be struggling, or somebody that you care about might be struggling, it's really important to pay attention to what you're feeling. And honestly, it doesn't matter. Some people, I talk to them on the phone and they say, you know, I want to figure out if I have something. And really, if you are questioning it, if you're thinking to yourself, I just don't feel right, well, that's what you need to pay attention to. It doesn't matter if you fit the criteria for a diagnosis. It matters that you want to feel better than you're feeling, right? So I'm not a big diagnosis person, but insurance requires that sometimes.
Well, that's a great response, and thank you so much for sharing that. I wanted to, now we have parents on that are expecting or have received their baby into this world, but also for those parents that are listening, and maybe you have some friends or family that are struggling with getting pregnant. Rachel has some workshops that I tagged in. If you go into the Ask Question area, it'll say Rachel Rabnor, LCSW, and it has her email address. If you have any questions for the future, you can contact her directly. You can always email me at tribedoula@gmail.com. But I've also put on there her website for some of her seminars that she does for couples on the front end of infertility. Do you want to elaborate on that a little bit?
Yes, I would love to. But first, I do want to say that it's actually they're women only. Okay. So just a correction there. Currently, at least that's how they're being offered. So I've been running these. They're 6-week mind-body infertility support groups, and I've co-facilitated them before, and also run them on my own. Co-facilitated with a naturopathic doctor, Dr. Elizabeth Winter, who's fabulous, and also run them on my own. And they are just really wonderful healing opportunities for women who are struggling with infertility. And we focus on mindfulness. That's another thing when you ask, what do I do with my postpartum clients? I do a lot of mindfulness practices, ways to help just to bring calm, bring some peace into the everyday. And with my infertility clients as well, there's so much anxiety around everything with infertility. It's really hard to stay in the present moment. It's always thinking about the next test, the next procedure, what if. And so being in the present moment is so very important. And it's such a buzzword. It sounds kind of like it couldn't be that true and that good, but really that has been so effective for so many people. And so we explore a lot of different strategies, from journaling to mindfulness and breathing, and we do drawing and all kinds of things. But really we tackle different topics each week, and just things that are really prevalent among women who are struggling with infertility. But there's a whole lot of more information on the link.
Click. It'll eject you right there. And I just want to thank you so much for being a pillar in our community. And hopefully this webinar can stretch out and reach everybody in all kinds of communities. But if you do need to get a hold of Rachel at any time, like I said, her information is in that Ask Question bar. And from the bottom of my heart, thank you so much for supporting this project. And we'll talk soon.
Wonderful. Yeah? Thank you so much for having me.
All right. Have a great night, Rachel.
You too. Bye, Christina.
And for everyone else tonight, I just want to thank you so much for the dedication of your time to be your best advocate. I want to thank all of the speakers that took time out of their busy work schedules to be present with us and to give us their expertise. If you have any questions, as always, like I say, email me, reach out to me on Instagram, Facebook, even right here in the comments. I'm here for you. I hope to put together some more hot topics in the future. But for now, stay present, know that you're strong, unite as a couple, and beautiful things are going to happen. So thank you so much for trusting in my time, and I thank you for yours. Take care.